I am so excited for our interview today on Meet Your Body. So, we are talking to Dr. Alicia Jeffrey-Thomas. Now, let me tell you a little bit about Alicia. She's been a pelvic floor physical therapist since 2016 and treats people of all genders in the Boston area. She isn't one to shy away from taboo topics, which you will hear about today in our interview. From bladder problems to bowel movements to sex, Alicia is always game to talk through the dirty details to help patients figure out what's going on down there. She's the creator behind the wildly popular The Pelvic Dance Floor account, a social media presence with over 1 million followers across Instagram and TikTok, where she uses humor and shares evidence-based pelvic floor health in a relatable way. Her first book, Power to the Pelvis, aims to further that mission and empower people to take charge of their pelvic floor health. And that book is available right now. Now, you guys, I first found Alicia on Instagram actually, probably 2 years ago. And I was so drawn in by the information first, and second, her humor and the way she delivers it. She is going to tell you how it is when it comes to pelvic floor health. And the information that she has is so incredibly valuable to all of us. So we dive into some of those taboo topics that are so important when it comes to pelvic floor health. And we'll also really talk about how you can take ownership over your own pelvic floor health. I love this conversation. I truly could have sat and talked to Alicia for days, and I told her that. I basically found her online and said, please come onto the podcast. I want to talk to you. You guys need to listen to this episode. I am so excited to bring you this interview with Dr. Alicia Jeffrey-Thomas. Thank you, everybody, so much for being here today. You heard my introduction to this podcast, so you know a little bit about our interview today, and I truly could not be more excited, both as a woman who's been through a lot of pelvic floor issues and dysfunction, and as a physical therapist myself. I am so excited to bring Alicia to the podcast today, so thank you so much for being here.
Thank you so much for having me.
And would you just tell everybody about yourself, like whatever part of your story you want us to know, wherever it starts?
Sure. I'm a pelvic floor physical therapist. I've been a pelvic floor therapist basically since I graduated from PT school about 9 years ago. And so that was, I fell into pelvic floor therapy because I really saw this need for helping people out with these very vital bodily functions, things that were seen as taboo, especially growing up in the South where, we really didn't talk about a lot of this stuff, and giving people the tools to kind of take back control of their life, to be able to live their life and not be kind of inhibited by these, little problems with their pelvic floors that they're too, they're not able to speak about.
Yeah.
So I've been doing that for 9 years. And about 5 years ago, I started a Instagram page that blew up and became also a TikTok page that blew up even more. And so, now I'm here.
Yep. And you guys, I am not kidding. You'll have all the links below. Alicia has the most amazing Instagram page for pelvic floor because it's exactly what you said. Like, you kind of said all these little things, and they're little, but also they're huge, right? Like incontinence and constipation and pain with sex. The doctors will kind of call them little things and almost brush them off. Oh, it's normal. You're a woman. You have to deal with it. But those issues hold us back in so many ways. I mean, we can't do our regular workouts, or we get scared to even squat, or we lose intimacy, and then it'll mess with our stress and our nervous system. So they're actually huge issues that, like you said, we're almost embarrassed to address, or we do address and we're brushed off by our doctors. So the fact that you you really were one of the first ones out there that was talking about it, but also from a place of science. I mean, your background and your licensure and your certifications, I'm like, this is someone who knows exactly what they're talking about and bringing it in a really relatable way. I mean, I hope you don't mind me saying, but when people go to your Instagram page, they're going to see your profile picture and you have a poop emoji hat on your head.
Yep.
It's amazing. So I guess jumping into that, I'll jump right into it. I would love to talk about that. I want to talk, and I told Alicia before this episode, I wanted to talk about a few things that don't get talked about as much that are so important. So, one, I would love to talk about elimination, about constipation. Tell us how that relates to the pelvic floor and maybe what women should kind of look for in their own health when it comes to their digestive and elimination systems.
Yeah. So, I mean, your pelvic floor your pelvic floor covers all of the openings down there. So, not only we're thinking about urinary health, but we're also thinking about bowel health as well. And so, if you're not eliminating well, then that can be, if you're straining, you're putting pressure onto your pelvic floor, which can be weakening it over time. And also, if you tend to get backed up, that can put pressure on your bladder and that can affect some of your bladder
Mhm.
symptoms as well. So all of these things are really related. Even if somebody comes in for a purely urinary issue, I'm still asking about all these other pieces because it's so rare that one just exists as an island all by itself.
Right, right. And how do you feel about things like the squatty potty
Oh my gosh, I
for
love the
pooping?
squatty potty.
Okay.
I have one in every bathroom in my house. We have them in the bathrooms at work. My friend, when my book came out, she made me a custom pelvic dance floor squatty potty that now actually is sitting right under my feet so that I have good posture while I'm sitting here and, doing my podcast.
Yeah. And if people, and actually, how would you explain it for people listening who are saying, what in the world is a squatty potty or what does that do anatomically? Tell us
Yeah.
why that's important for pooping.
So when you're sitting with your feet just flat on the floor, what happens is your colon is kind of being held at an angle like this because your pelvic floor muscle is kind of kinking around that
Mhm.
large intestine. So if you elevate your knees so that they're a little bit higher than your hips, what happens is that relaxes the pelvic floor a little bit. So it unkinks the colon and gives you a little bit of a straighter path to the exit. So
Right.
it's less straining, less pushing, more complete emptying, all of
Yep.
those things that we're trying to get to.
Yep. And people could use, I mean, if you don't have an actual squatty potty, I mean, you could use a stool, anything to put your feet up.
Exactly. I'm not, saying you have to get this name
Yeah.
brand thing. I mean, my mom, I feel like should have patented this when I was a kid because she
Yeah.
was always the one turning the trash can on its side and saying, "All right, put your feet
Oh.
on this," because I was a very chronically constipated kid. Um,
Oh.
so, I'm like, we could have been millionaires.
Missed the chance.
Exactly. But even if you're traveling, right, you can
Right.
always turn your suitcase on its side, or you can use a couple of toilet paper rolls and put your feet on top of that. I've seen people use yoga blocks. It's really whatever works best for your body because it's also going to depend on the height of the toilet, the height of the person. You just want to get your knees higher than your hips.
Okay. That is such a great tip. And again, going back to, I see so many clients with chronic constipation.
Mhm.
And again, I feel like that's kind of brushed off, but it is huge when it comes to your digestive system, your pelvic floor, so many things. Do you have, and I know every client is different, do you have some easy tips or things people should look at if they do find that they're chronically constipated?
Yeah, I mean, and I think first of all, you want to make sure that people understand that you can poop every day and still be constipated. Like you can define constipation in a bunch of different ways
Okay.
because if you're having, smaller incomplete bowel movements, that can be just as, designated as constipated as pooping, twice a week and having little rabbit pellets. Like there's all of these little pieces that
Right.
can go into it, right? So we start kind of from the intake standpoint. We're making sure that we're staying adequately hydrated. We're making sure we're getting enough fiber. We want to make sure that we're moving our bodies because movement helps to stimulate peristalsis, which is that movement of
Hmm.
stuff through the colon. And oftentimes, like when we're feeling full, it's like the last thing that you want to do is move around, but that is going to be the thing that's going to help to get it going. And then getting to the point where you can relax your pelvic floor so that you're not
Hmm.
pushing and straining. So adequate positioning like we talked about before, but then also the pushing strategy
Yeah.
itself isn't actually pushing, it's more working on relaxation, breath work, exhaling and not holding your breath when you're going, different things like that. I love to cue for pretending like you're blowing bubbles through a bubble wand or that you're blowing on a pinwheel because it creates that kind of slow controlled exhale and not
Hmm.
that
Yeah.
straining kind of position.
Right. Absolutely. And how do you feel about castor oil packs in general?
I don't know that I have a strong opinion about them. I'm not usually the person making the recommendation. If somebody, does it and loves it, then
Right.
great. Yeah.
Okay. And backing up, because I got so excited about constipation and pooping, everybody,
I mean,
because
we
it's
all do,
such a
right?
huge topic that's not talked about enough. And I think it's just such a great indicator of overall health. So hopefully those tips helps a little bit. But let's back up a teeny bit. And like everybody listening probably knows, I'm a physical therapist. I've been a licensed physical therapist for like 25 years at this point, but I'm not a pelvic floor physical
Mhm.
therapist. So can you talk, just for people wondering, what is the difference even? What does it mean to be a pelvic floor PT?
Totally. So, physical therapists are trained as generalists. So we all come out with the same education for the
Mhm.
most part. Um, I was able to differentiate a little bit in my clinical rotations. So I had a full time
Okay.
pelvic floor rotation where I was one on one
Mhm.
with a pelvic floor therapist. And I think that that was really instrumental in getting me, confident in starting into that field. But the difference in pelvic floor therapy is we're looking at all of those same things. We're looking at strength, range of motion, coordination. We're just looking at it through the lens of what's happening with these muscles that are internal.
Yeah.
So the like I said before, the pelvic floor runs from the pubic bone up to the tailbone. It covers the urinary opening, the vaginal opening, and the bowel opening. And also men have pelvic floors too. It just they don't have that middle opening. So it's important to kind of note that you get specialized training to become a pelvic floor therapist, whether that's mentored clinical time or that's taking courses where you're learning how to do these very specific types of exams. So we go in with a additional lens.
Mhm.
Because we still have those other regular PT lenses. We're still looking at the whole body. We just have this extra specific set of skills. I'm like the Liam Neeson of the pelvic
Yes.
floor.
Absolutely. And that's what I kind of tell people is I don't do the internal work.
Mm-hmm.
Like I will look at the whole body, and the fact that I work with women mostly, so I do a lot of women's health. But yeah, I don't do the internal work, which is so necessary and important when someone is having pelvic floor issues. So
Right.
if you're listening to this, or if you're a healthcare professional listening to this, I think it's so important to have a pelvic floor physical therapist on your team or in your back pocket, or someone that you can refer to who you trust. And it's fairly easy to search nowadays. I mean, pelvic floor or women's health PT, look for recommendations. But I don't know if I could say that there is a more important team member in that you can have just again in your back pocket for postpartum, for hysterectomy, for pelvic floor as we age. I mean,
Mm-hmm.
I would be interested to know, with your clientele, are you seeing a lot more women now kind of in that perimenopausal, postmenopausal transition who are becoming luckily more aware with the information we have, but are experiencing, genitourinary symptoms, prolapse and those kind of things?
Yeah, no, absolutely. I think that's been a big area of growth in the pelvic floor world. I mean, as in the rest of the world, I feel like menopause is really having a moment right now, which
Yeah.
is awesome. But it's interesting because we used to have the dichotomy of pregnancy and postpartum and like long postmenopausal,
Mm.
you know, older women who were coming in who had maybe like been having issues for years. And now that they're further and further past menopause, now they're like really starting to have issues. And now we're seeing this kind of middle ground of people who
Mm.
are in this transitional phase and they're maybe getting the information. They're like, oh, the stuff that happened to me in, childbirth might be starting to be some of the driving factor in what's happening in menopause plus this hormonal shift. And so what can I do to get on top of this now so that I don't
Right.
see what's happening to my mom, my grandma, my aunt, whatever happened to me?
That is such a good point, and I'd never heard it put that way, but you're exactly right. I am seeing so many women who used to feel like they were in that gray area of,
Mm-hmm.
okay, I'm not exactly postpartum, but I'm not 75. So I don't think there's anything wrong with me, right? Like there can't be, or there's no reason. And you're exactly right. It's just a spectrum as we age. And I think too, it's important to know, I mean, I see quite a few women who are shocked that they're having pelvic floor issues in their 40s and 50s because they never gave birth. They
Mm-hmm.
didn't have kids. And I think it's so important to realize that is not the one determining factor if you're going to have
No.
pelvic floor issues.
No, I mean even in, our younger populations, I see
Mhm.
people in their, late teens, early 20s up to 30s who are having, more like pelvic floor tension issues, pelvic
Mhm.
pain,
Mhm.
maybe pain related to endometriosis or something like that.
Mhm.
They've never had kids, but they're having significant pelvic floor issues. So it is a lifespan issue. It's not
Yeah.
determined by, whatever life events that you've gone through. It is just, it can happen to anybody with any body.
Yep, absolutely. And speaking of, that's a great transition. So we talked about constipation. I want to talk about sex also. Like I said, I want to
Yes.
hit the subjects that aren't talked about enough.
Yeah.
I was diagnosed with endometriosis in '05 after my first surgery. And I remember one of the first things I was told, because I said, I'm having pain with sex.
Yeah.
And the answer was, take ibuprofen beforehand. And like
Great.
that was what I was told back then. And I said that there's got to be a better way. That's
Mhm.
not an answer from a healthcare professional. So pain with sex is extremely common. Talk to us a little bit about that and then how pelvic floor PT can help.
Yeah. So, there are a lot of different factors that can drive pain with sex. When I'm doing an intake for this type of issue, I'm asking really specific questions. So you can't
Okay.
just tell me I have pain with sex, right?
Yeah.
I'm going to say, okay, do you only have pain with penetrative activity? Do you have pain with getting aroused? Do you have pain with other types of penetrative activity, like using tampons or having a speculum exam? Is it more at the entrance? Is it deeper? Is it both? Does it last after the fact? Like all of
Mm-hmm.
those things are going to tell me different things about what's going on. But when we're looking at this from a musculoskeletal perspective, because you kind of have these stacked layers to the onion that is the pelvic floor, you can have more tension, more pain towards the outside. You can have it kind of deeper back. So as that pelvic floor is kind of slinging back towards your tailbone, you can have
Mm-hmm.
more tension back there. And maybe that's more deep thrust pain. And then all of these things can be layered by other stuff. So if you have, a hormonal shift where you have decreased estrogen, then all of a sudden you might have, more of that like teary, rippy, burny entrance pain. So there's lots of different factors that we're looking at there.
Mm-hmm. And typically, when someone comes to you
Mhm.
and they're willing to address it, do you find, and I know this is a hard question too, is it something that a lot of times one or two visits you can work through? Is someone seeing you for 10 weeks? And that might even be a larger question in pelvic floor PT as a whole.
Yeah, I was going to say, I think that that speaks to any type of PT, right? Like we all say, it depends.
Yeah.
And it depends on so many
Yep.
different factors.
Yep.
I think, their pain with sex is one of the ones where it tends to take a little bit longer
Mhm.
because it's not something that happens overnight.
Yeah.
This is something that usually has been kind of brewing in the background, and either somebody has been embarrassed to bring it up to their provider, or they've been, they have brought it up and been gaslit and told, oh, that's normal. And
Yeah.
so by the time they're finally getting help, this is something that is really kind of cemented into the nervous system a little bit more. And so it takes a
Okay.
while to unwind it and figure out all those different factors, because there could be musculoskeletal factors, but there could also be, some like just nervous system body wide, like anticipating that there's going to be pain, so we're guarding up even more. And so there's so much that we have to kind of unpack there.
Mhm.
I mean, I have people where, yeah, I'll see them for 6 to 8 visits and then they're better. But then there's people who have, pain with sex layered with chronic pain from things like endometriosis, and maybe we're treating them more long term than that. So
Yeah. Yep. That is so amazing. And do you find, again, general question, how the healthcare professionals around you who are referring for PT, do they tend to be pretty supportive? Is that kind of communication and conversation becoming more empowered for women, or is it still hard for them to get the referrals that they need to see you?
I think that there are certain medical professions that are doing a really, really great job. So urogynecology, for example,
Mhm.
is one of the ones that I shout out all the time. They're like the surgical twin to pelvic PT. Like I feel like we speak the closest to the same language. They're big supporters of us. We're big supporters of them. We know when we need each other. And so they're usually like the first biggest cheerleaders to say, yes, go to pelvic PT. And I love that. Where I feel like we are getting better but still falling short of where we need to be is in the like regular OBGYN space. And like some of that is that these providers don't have nearly enough time
Yep.
with their patients to really kind of get the full picture of what's going on. But they're not necessarily the first ones to jump in and say like, yeah, go to pelvic PT.
Mhm.
Certainly there are some OBGYNs that are like really big cheerleaders, but I think on the whole as a profession, like I think that's an area that we could do better. But
Yes.
also I'm seeing so many more self referrals these days. people that are seeing themselves reflected in content that they're seeing online, or whether that's social media stuff that other pelvic PTs are making,
Yeah.
or just celebrities that are talking more about their birth experiences or their experiences with endometriosis or something
Yeah.
like that. So they're learning, oh, hey, I can seek out this treatment, and especially in states where there's direct access, like they're able to get this care.
Absolutely. And I will absolutely reiterate that. So, having a prolapse after the birth of my first daughter, I saw my OB and I was really told, well, maybe see some pelvic floor PT. Yeah, you have a prolapse. Maybe try a pessary. Good luck. And I thought, oh, okay. He diagnosed me. I mean, great.
Mm-hmm.
I have a diagnosis. Really, not even as a PT myself. And then seeing a pelvic floor PT, not understanding the extent of that. It was 7 years before I saw a urogynecologist
Oh, wow.
who changed my life. Said, oh no, you have cystocele, rectocele, uterine prolapse, this and this. He was able to put numbers to it, able to put language to it.
Mm-hmm.
Um, and again, it was something I didn't even know was available to me as a PT, as a women's health. I had no idea. So I absolutely reiterate that. I think OBGYNs are great at what they do. That's what I
Yes.
tell people. They are great at pap smears, at keeping your cervical area and your vagina healthy and delivering babies. I mean, thank goodness we have them.
Yes.
If you have deeper questions around what is happening down there in your pelvic floor, I highly recommend seeking out a urogynecologist.
Yes.
They're going to just give you more in-depth information. And yeah, anyone who's going to support seeing a pelvic floor PT, see that person. And if they don't, if you're told no, you don't need it, find someone else.
Mm-hmm.
That's how I feel.
Like your primary care doctor can refer you to pelvic floor PT.
Yeah.
It doesn't have to be this subspecialist person. And honestly,
Mhm.
like I love the primary care doctors that I've
Mhm.
formed relationships with, because when I explain it to them, they're the people that are very often hearing about, pelvic pain and like stuff like that for the first time, from these patients. And so if we can get them to care sooner by working more directly in that triage system,
Yeah.
then I think that would be really great.
That's awesome. And one thing I wanted to ask you about, because it is on your social media, people are going to see it.
Yeah.
You talk about dilators a lot. So
Yes.
tell us about that, about what it is, the tool, the use, everything.
Absolutely. So dilators are devices that are used typically when somebody has pain with sex, or if they're trying to, decrease pain with pap smears or with using a tampon or something like that. They're progressively sized cylindrical devices. Hold on, I can actually, for the
Okay.
people that are watching the video,
Yeah.
you can see.
Perfect. Yes. If you guys are watching, we're looking at some right now.
So this is kind of the intro slash small set from a particular brand, and so you can see how each little cylinder, they're getting a little bit wider
Mhm.
with each progression. And so the idea is that over time, you're able to relax your pelvic floor muscles around this device. Not that you're like forcing any kind of stretch. You're saying, okay, can I drop my pelvic floor, insert this a little bit, relax a little bit more, insert it a little bit more. And then like once it's in, you can use it to apply, stretch around in different directions. Or if you have particular areas of soreness, you can say, okay, I'm going to like use this as the equivalent of like my finger to like stretch that way.
Yeah.
But it's a really great way to have that progression versus just, okay, I'm just going to stretch with my finger, or I'm going to be doing you these pelvic floor drops in Happy Baby, and then trying to, um, jump from that to a penis or a speculum. It's like a big jump.
Yeah.
So,
It's a significant difference. Yeah.
but they're certainly not mandatory. It's
Right.
like
Right.
I always tell people like all of these things are just tools in the toolbox. They're
Yeah.
all options, because there are a lot of people that come to pelvic PT who have, you know, medical trauma. They have, trauma from other experiences in their life. And I
Mhm.
really want to be respectful of those things and make sure that people know that in pelvic PT at all times, whether it's a device that I'm suggesting or even just the idea of an internal exam, like you decide what we do, and you always have the ability to modify the plan, say no, whatever.
Right. Like taking that agency over your own body. That's
Exactly.
amazing. That's so important. So for those of you who didn't get to see, or if you're listening, so a dilator is really meant to almost stretch the tissues, um, or allow penetration. Like you said, it's almost like allowing our body to open up and relax around that.
Yeah.
I get so many questions, and this is kind of a transition. This will be a
Yeah.
multi-part question.
Cool.
everybody knows about Kegels, right? It's like, oh, it's the gold standard. Stop the flow of urine. My pelvic floor must be weak, so I need to tighten it. And you're talking to us about relaxing the pelvic floor. And anyone who follows me knows I have videos, all pelvic mobility. We have a pelvic relaxation video.
Great.
Talk to us a little bit about that. And I know everybody, again, is different. Some people are going to need the strengthening, some people need the stretching, but talk to us about that a little bit, about what kind of that idea of everyone thinking, oh, I need 500 Kegels a day. What did that do? When do we maybe need both? What's the nuance around that?
Yeah, it's again our favorite PT phrase, it depends.
Yeah.
Everybody is going to be so different in how their pelvic floor is presenting. But the idea of a Kegel being the be all end all pelvic floor exercise is like if you told every person with a shoulder issue to do bicep curls. It just doesn't make sense. And in some cases can make things worse.
Yeah.
If you think about your pelvic floor as existing on a spectrum, you have people who have, low tone pelvic floor muscles. And so maybe they do need to be doing some amount of pelvic floor strengthening. Do I think that needs to exclusively be Kegels? No, because I need to figure out how that pelvic floor is needing to function during movements like, lifting, squatting, reaching, all of those things, making sure that it's responding in the right way. And so that's not just like, let me squeeze and hold, squeeze and hold, squeeze and hold. That's not going to get us to that point. But then also if you have pelvic floor tension, pelvic pain, constipation, where your pelvic floor is not getting out of the way, if you're just doing more Kegels, you're moving yourself in the wrong direction, right? Like you're making things more tense instead of focusing on the opposite. There are nuances to this, right? There are times where I will use a one-off pelvic floor contraction to help to facilitate relaxation, right? There's like neuro things that we learn in PT school about contract, relax, and how we can use that to facilitate more relaxation. Sure, I will use those when I deem it clinically appropriate. That is me knowing what's going on with your body and making that clinical decision. That's not everybody should be doing Kegels in some way, form, or fashion.
Right. And let's take that into squats, my other favorite thing. So being, again, someone who's experienced prolapse and prolapse repair and working with women, I have a soapbox about how many women are told, don't ever squat again when you have a prolapse or pelvic floor, right? Or pelvic floor issue. That is not helpful, in my opinion. It's not helpful, and it's not contributing to function. I mean, we squat all day long, and
Literally
we know our
every time you get,
right, every time you're on and off the toilet, every time, and we know our longevity is attached to our ability to squat. So tell us clinically, why is it okay, and how is it okay to squat when there's pelvic floor issues?
Yeah. So like we said, right, every time you get on and off of the toilet, out of a chair, out of your car, you're doing a squat. So for somebody to tell you to never squat, they just don't understand how day-to-day life works. And I'm not taking any advice from them.
Right.
So, we need to be able to do those motions, even if we never load it any further than that. You need to be able to do those motions and know how to do them with respect to your pelvic floor, your breathing, your core, all of those pieces, right? So whether that's as simple as I'm cueing you for an exhale as you go to stand up, whether I cue you to do a pelvic floor contraction, it depends on what that individual needs. But that movement is so integral into daily life, into safety and longevity. Like we need to be able to squat. And then you can take it even further and say, okay, if we can load that activity, right, that's then helping with bone health, that's helping with overall muscle mass, and how we're going to be able to move into the later stages of life and be healthy.
Right.
So
Absolutely. Yeah. And it's that idea of, it doesn't have to be black or white, yes or no. Like, yeah, you might be on a spectrum. Like you said, maybe we don't end up loading it depending on your situation.
Right.
Maybe we can load it over time, or maybe you're on your back doing a leg press instead of a loaded squat. But someone telling you, no, you could never do that again is not the answer.
No.
Yeah, but thank you. for that.
I agree. We're on the same page.
Great. Awesome. And so, how do you incorporate exercise? So, knowing, like you said, you're a generalist, but also you're working with the pelvic floor.
Yep.
Are you working with a team for that, or do you have specific exercises or how does it kind of work as you progress clients and get them independent and sending them home again? What are you
Yeah.
looking for?
So, I mean, I'm looking at a lot of things. I mean,
Yeah.
if somebody is specifically worried about feeling, prolapse symptoms when they squat, right? I can do everything from, taking them through the bodily awareness of what their pelvic floor is doing when they're just doing this in a fully clothed way, all the way up to we can do an internal assessment while they're standing, while they're squatting, and seeing what's happening with those muscles so that we can know, for sure, okay, we're not just guessing this is what this muscle is doing. What can we change with our cueing? Are we changing your breathing patterns? Are we changing what you're doing to, squeeze the pelvic floor? Are we changing what you're doing with your squat form in general?
Mhm.
Those are all things that are still within our wheelhouse as pelvic floor therapists, because we have that generalist education. So,
Yeah. Yeah. And so going with that, I just would love kind of even again a general view.
mhm.
If people are going to, which I highly recommend anyone listening, if you have access to it, find a pelvic floor physical therapist. What can they expect kind of from the first visit and then through the first few?
Yeah. So day one is a lot of talking. And so if people are like, oh my gosh, I'm gonna like have to get undressed on day one, like don't worry about that, because honestly, like the vast majority of the first visit is spent talking. I'm asking you about the history of what's bringing you in. I'm asking about your medical history in general. And then I'm getting into all those nitty gritty things that you didn't think that you were going to need to talk about. You said, I'm coming in for a bladder issue, and I'm asking about your bowel. I'm asking about your sex life. I'm asking about your exercise routines. I'm asking about all of these things so that looking at the we're looking at all those factors when we're forming our hypotheses about what's happening before we ever even get to the exam.
Mhm.
And then after that, I'm actually starting with more of an orthopedic looking exam. I'm seeing how you're just moving around, how you walk, how you squat, if you can stand on one leg. We're looking at strength and range of motion
Mhm.
and all of that in the hips, and how all of that is going to then factor in. I'll do an abdominal assessment where I'll, look at your belly, see if you have any separation in your core, or if you have, tightness in the connective tissues, if you have old abdominal scars from surgery that might have restrictions. And then and only then do we talk about what you're comfortable with from a pelvic floor assessment standpoint, right? That never has to happen on the first visit. It doesn't have to happen on the second visit. We can talk about it in terms of layers. We can look just externally and kind of observe and see what's going on. We can palpate externally to get an idea of what's going on. Again, it's all just every piece that we're able to take on is just more information that we have to form a more accurate diagnosis. Um, an internal exam in pelvic floor PT isn't like a pelvic exam that you get at your OBGYN. So there's no stirrups, no speculum, no
Mhm.
scary stuff. It's a single digit vaginal exam that's mapping only about to the second knuckle of your finger
Mhm.
to assess the, tone of the muscle. So is there tightness? Is there tenderness, or something that reproduces another symptom like urinary urgency? Or, when we test that coordination, are you able to contract the pelvic floor without using other muscle groups? Do you have the ability to hold that for any length of time?
Mhm.
Are you able to quickly contract and relax? What happens when you bear down? Are you able to lengthen and relax your pelvic floor? So there's all kinds of little different pieces. And again, it's all kind of choose your own adventure depending
Mhm.
on what your therapist feels like they need to look at and what you're comfortable with. So,
Yep. And do you have advice? I'm guessing you've gotten this question with how big you are on social media. Do you have any advice for people who are in rural areas, who are in healthcare desert areas, who don't have access to a pelvic floor PT? What is your kind of general advice or instruction in that case?
sure. In that case, it's kind of like I don't want to let good be the enemy of or perfect be the enemy of good, right?
Mhm.
Whatever that phrase is.
Yep.
And so there are certainly, with the pandemic, there are a lot more people who are offering virtual services
Mhm.
these days. There are people who are very good at it. Like they're
Yeah.
able to walk you through doing a self assessment. Like you're not on camera
Mhm.
doing anything for anybody. Like they'll give you the instruction and you can do that on your own time and then kind of report back. There are other resources for self-assessment. I mean, in my book, I put in a self-assessment section because I told them I can't realistically give advice on someone's pelvic floor unless they have some idea of where their pelvic floor falls on the spectrum of, weakness, tightness, all of the above.
Yep. And that's perfect segue. Okay. Tell us about your book. So, you guys, you have to go out and get Alicia's new book. Tell us all about it.
So, my book is called Power to the Pelvis, and it's basically the DIY guide for your pelvic floor because there are a lot of people who don't have geographical access, financial access to a pelvic floor therapist. And those people still deserve care. They don't have to just like live their lives with these symptoms. There are a lot of things that you can work on independently. It's not a substitute for pelvic floor therapy, but I
Mhm.
at least want people to, use it as a way to learn what's happening with their bodies and start to work on some strategies that will start to improve their quality of life. So it takes you through everything from, the anatomy of the pelvic floor, different types of conditions that pelvic floor therapy can treat, a self assessment section so you can start to get an idea of what's happening with your pelvic floor. And then it breaks down different exercises for different issues, different behavioral strategies for different issues. I have a whole section about, like how to do self mobilization for scars if you've had a C
Yeah.
section. And then we also get into things like, how to advocate for yourself if you, do go to a provider's office and you're saying, hey, I have these symptoms. Like, how do you get them to take you seriously? So
Yep.
I wanted to make it a resource for people to kind of take with them throughout their lifespan, no matter what's going on with their body, right? This isn't just the women's pelvic floor book for if you've had babies. It's, it's the everybody, every pelvic floor book. Because we're, in this way, like we're a lot more alike than we are different. There are
Mhm.
certain things that come up at certain hallmarks of life, but they can come up honestly throughout the lifespan, and I don't want people to feel siloed in that way. I want to kind of invite everybody to the table, and that was kind of the goal of this book.
Absolutely. And I think just having another tool in your toolbox of how to use your voice and how to explore a little bit at home on your own. I feel like that is one thing about the pelvic floor is somehow we either feel like we have to share it all in the office of healthcare professionals. Like we
Mhm.
strip down to a gown and we, like you said, we spread our legs and it's like, okay, here I am. So it's like either that's our option or we're at home in a closet by ourselves, not talking about it.
Right.
And there's this whole middle ground of, you know what? I have a pelvic floor. You have a pelvic floor. We're out there talking about poop and sex because it happens to all of us.
Yeah.
And this book will allow you then to explore yourself at home. I mean, I think
Mhm.
there's so much power in, okay, I just have a book and I'm at home and I'm on my bed. Where do I put my hand? How do I examine myself? What does my scar feel like? I feel like you said, with C-sections and hysterectomies, there can be so much trauma involved that we don't even feel our own scars for
No.
years afterwards.
Right.
And so you're giving people permission to explore and connect to their body in that way. And even that gives people agency and a voice, I think.
Yeah, no, I absolutely agree because again, it's, a lot of people aren't told to do anything with their scar afterwards,
Yeah.
and then if they have sensitivity or if they have numbness, it's this kind of like icky feeling where you
Mhm.
become avoidant and you don't touch it, and
100%.
then it becomes this thing where, the muscles around it maybe aren't functioning the way that they should. So you're right, like this gives permission to be curious, to
Yes.
explore, to, ask questions about your body.
Yes. And for those listening, you'd be amazed. Like it's amazing how many people I'll see because I will see Zoom clients and they're having problem with the squat. So the complaint is a squat is hard or I get hip pain with a squat. Watching someone squat, I see the protectiveness in that pelvis. Like the pelvis is not moving. It's so guarded. And sometimes it will go back to that C-section they had 25 years ago that never quite felt comfortable to them. And they then didn't feel comfortable with their body and how it looked. They stopped touching the scars. The pelvis guarded more. And so don't discount the importance of that, of just finding freedom and how the pelvis moves. It will affect function in exercise later on. It's truly amazing, the connection.
Yeah. No, absolutely. No, it's there's so many things that we could say about, how yeah, a lot of people then kind of get it into their minds that, it's too late for me to do pelvic floor therapy because this was 10, 20
Mhm.
years ago. And there's no such thing as too late in the pelvic floor world. Like we said, like these things happen along the entire life spectrum.
Mhm.
And even if it's an issue that you've been dealing with for years, if it's a scar that's existed for years, if
Mhm.
it's, whatever, there are still tons of things that we can do to address those issues.
Yes. And your function and your quality of life matter. Again, I think that's sometimes brushed off, especially as we age, but it matters. You can have a healthy sex life and an enjoyable sex life. You can have a healthy movement practice. All of that might not look how it did 30 years ago. I mean, you might have to adjust how you're intimate with yourself or partners. You might have to adjust how you exercise or how you move,
Mm-hmm.
but it is still available to you if you take the steps to, yeah, find that agency, find your voice. And I think this book, there's nothing that I have seen out there like it. So I will be the first to say thank you because I will be sending all my clients to this book. So tell us how we can find it, how we can find you, all our steps to take.
Yeah. So, Power to the Pelvis is available at all major book retailers. So you can get it at Barnes and Noble. You can get it from Amazon. You can get it from bookshop.org, which supports indie bookstores. You can request it from your local library.
Mhm.
There's tons of different ways that you can access this book. It's available as a Kindle version. It's available as the
Great.
physical version. So the only thing I don't have is an audiobook. But if you want to access this, there are plenty of ways to
Yeah,
do it. I have all of the links to get to the book listed on my website. So yeah.
great. And we'll have all those links below. And then how do we find you on social media?
On social media, I am at the Pelvic Dance Floor on both Instagram and TikTok.
Yep. And you guys really like that is such a great way to just go and kind of lurk. And that alone, I find it is so empowering. Like just even if you're not ready to like quite explore on yourself yet, watching someone else talk about it and be comfortable about it and use humor around it is really important. Like that alone will kind of open up your own communication and your own confidence, I feel, around your body when you watch and listen to someone else doing the same thing. So, if nothing else, go find social media, find Alicia, watch, look at what dilators are, just start to learn. Like
Yeah.
knowledge is power. Knowledge is power. So thank you so much. I am truly so appreciative for the work you do and also taking the time to be here today.
Well, thank you so much for having me. This was really fun.
Thank you. All right, I'll talk to you soon.